Thank you, Dr. McGonigal. And it's my pleasure to serve on the Autism Advisory Board with Dr. McGonigal, who is, I think, a great resource here for those of you living in Southwest PA. Now, you've heard presentations about the status of research in autism, and there's a number of other great presentations today about various treatments. But the question that I'm going to speak to is, how do you pay for it? And these services are not cheap. Now, if you're lucky to get into one of these trials, that may be covered. But for many other folks and for the kind of day-to-day services and supports that individuals on the spectrum need, the question remains, how do you pay? So, let me just, hello, there it is. So one of the places you can get some advice for paying for services is through the organization I work for, the Health Law Project, and we are a nonprofit public interest law firm, and we do provide free legal advice. So one person you don't have to worry about paying for is us. We provide advice regarding eligibility for medical assistance, services under medical assistance, the home and community-based waivers, which I'm going to be talking about today, and we also can provide actually free legal representation to individuals on appeals. To contact us, toll-free number, which is in your materials, the 1-800-274-3258. We also have a website, which is phlp.org. Now, I've rearranged a few of the slides, so they may not be in exactly the same order, since each time I do this, I make some changes that hopefully make it flow a little better. I also want to say that for my presentation, unlike the others, I don't really like standing up here and just blabbing. So I really would be happy to take questions. So it's okay if you have a question that's relevant to the particular material that I'm going through at the time, please feel free to ask me your question. Do understand, though, we don't have enough time to go into detail about any person's individual situation. So you can speak to me after the session if you have something that's an involved individual case. But if you have a general question that's relevant to this, please feel free to ask. Okay, why should you be interested in medical assistance and waivers? One, because most insurance plans don't cover the full range of supports needed by children and adults on the autism spectrum. Second, private pay for services is often very costly, especially if you consider the costs over the individual's lifespan. And lastly, medical assistance and the waivers have broad coverage, in most cases much broader than a typical insurance policy. And medical assistance is available for children with significant functional limitations, including many who are on the autism spectrum, regardless of family income or assets. Now, that's unique to Pennsylvania, but it does mean that medical assistance is not only for poor folks. It is also for individuals, for children at least, under 21, regardless of their parental income. Now, I'm going to start out by talking about kids first, and then we're going to move into adults. How do children receive this medical assistance? You have to qualify in a number of different categories, and there are two primary categories for children on the autism spectrum. The first is SSI. Now, SSI is a Social Security program. It's also for adults as well, and we'll talk about that part a little later, that have low income and assets and who meet the Social Security disability criteria. Now, the SSI program provides a monthly cash benefit, but what's most important for us here today is that it also provides full medical assistance coverage. A separate application is not required for the medical assistance piece. If you apply for SSI, found eligible, the child gets both of those and gets the MA automatically. However, for SSI, the income and the assets of the custodial parent are counted for children under the age of 18. So unlike when I started, I talked about medical assistance is available regardless of parental income, and it is, but that's under a separate category. For this program, SSI, the income and the assets of the custodial parent are counted until the child turns 18. Now, the category under which a child on the autism spectrum may qualify for medical assistance regardless of parental income is called PH95. Now, it's known in the community generally as the loophole. And this is available provided that the child's disability or medical condition meets or equals the Social Security disability criteria. You apply for this at your local county assistance office, and in Allegheny County there are several different district offices, and it depends where you live. But you can also apply online at the website on your materials, compass.state.pa.us. You will have to submit by mail or in person a number of documents like birth certificate, Social Security card. But you can start the application online. And there is a question there, does anyone in the household have a disability? And that's how you indicate that you're applying for this medical assistance under this special category, PH95, where the income and assets of the parents do not count. Now, although the income and assets don't count, the parents do have to tell the county assistance office or on the web application what their income is. I know that's confusing, but that's a requirement of state law. Now, the child may have income. Some of that income doesn't count and some does. Social Security benefits. Now, this is different than SSI. The Social Security benefits that a child may be receiving, typically on the account of a deceased parent or a parent who themselves is receiving Social Security disability. Those benefits do not count for medical assistance under the age of 18, under this PH95 category. Also, if the custodial parent is receiving child support for that child and it's court ordered, that does not count for the medical assistance. However, if the child support is voluntary and there's no court order, then that would count, and the child support could disqualify the child from receiving medical assistance benefits. So in a situation of a divorce or separation where child support is involved, even if the parents have agreed upon a child support amount, it is advisable to go to domestic relations and make sure that that agreed upon amount becomes a court order so that the amount of the child support would not affect the child's eligibility for medical assistance. Now, I talked about Social Security benefits. Let me just mention and distinguish them from the SSI. So there's two kinds of Social Security that a child might receive. The SSI, and the SSI is based, one, on the child having a disability as defined by Social Security, and secondly, that the income and assets of both the child and the custodial parent or parents below a certain limit. But there's also Social Security that a child may receive which is not based on the child's disability and which is not based on the income or assets of the parents. And that's known as child's benefits. And that is based where the child's parent has either deceased or is receiving retirement benefits, or the parent is receiving Social Security disability. And in that case, excuse me, in that case, the child can receive these Social Security benefits. That is, the parent gets an extra payment amount in the name of the child. Again, that money does not count for medical assistance, but you have to apply separately for the medical assistance. Getting Social Security benefits other than SSI does not automatically entitle the child to medical assistance. Okay. Now, there is some income that can count, and that is payments from an annuity where the child is listed as the payee. The situation we have seen is, and this usually comes up in the context of a settlement of a lawsuit. There could be a malpractice case, or it could be a personal injury award. And in that situation, if there is not a special needs trust established, the money that's coming, and if it is coming in the name of the child and under the child's Social Security number, then that money could very well affect the child's eligibility for medical assistance, even under the loophole category. So it is important, if you're looking at the child receiving any kind of money, either from a lawsuit or from other relatives, grandparents, whatever, that money, that you seriously consider establishing a special needs trust, that money would go into to keep it from affecting the child's eligibility for medical assistance and eligibility for both medical assistance and SSI as the child ages into adulthood. You do have to understand, however, if you create a special needs trust, that money can only be used for special needs. A special needs trust is only exempt if it is not used for basic ongoing living expenses. So it cannot be used to, for example, when the child becomes an adult, cannot be used to pay a rent or mortgage. It cannot be used for ongoing food expenses. So there are limits to how that money can be used. Now, I said that to qualify for the medical assistance and also to qualify for the SSI, the child must meet Social Security disability criteria. And that's different than saying the child has a disability or saying that the child is on the spectrum. There are specific criteria. And the criteria are not necessarily the same criteria that you heard previously in terms of the definition of autism. The criteria are found at that website you see there. And the criteria are divided into bodily systems, and for reasons I don't understand, Social Security has placed the criteria for autism spectrum into the broader category of mental disorders. And let me go to, this is what the website looks like. If you go on Social Security's website, it's a very good website, ssa.gov, and the criteria are listed there, and that's at the bottom. You'll see on the bottom left, you'll see 112 mental disorders. The criteria are here in some detail. I'm not going to read through this. The criteria are in your materials. What's important is they have documentation by a physician, psychologist, developmental neurologist, or developmental pediatrician. Psychologists should detail the behavioral conditions, medical conditions also that may be comorbid, how they affect the child's functioning. Any test evaluations, hospital and school records are also important, either for SSI or for medical assistance under the loophole. This is a section of the Medical Assistance Eligibility Handbook which talks about the kinds of evidence that medical assistance is looking for in order to determine whether the child has a disability that meets the requirements for medical assistance under the PH95 category. Also in your materials, you'll see a worksheet. This is the worksheet that Social Security uses for parents to fill out when they apply for SSI for a child. And the reason why I included it here is it shows the kind of information that the family needs to pull together before they make the SSI application. Now, while medical assistance does not use this specific worksheet, I think it is also useful as an organizing tool so that when you're applying for medical assistance for a child on the autism spectrum, you know what you need to pull together for that application. Now, if you're applying for the medical assistance, the county assistance office can make a presumptive disability determination so that medical assistance can be authorized in the meantime without waiting for the full disability determination. A full disability determination often takes several months. You don't have to wait several months to get the medical assistance. And in your materials, you'll have the section of the state's own handbook that explains this, what they call presumptive eligibility, that authorizes the caseworkers to grant medical assistance to a child with a significant disability without having to go through the full disability determination process. Now, it does mean, however, that you have to provide verification, and this handbook talks about what kinds of verification is acceptable: a child's IEP, an early intervention eval, a discharge report. However, you should know that for disability purposes and for medical assistance purposes, an IEP is not in itself sufficient. So I have had parents who've said, oh, well, my child has an IEP, so the child qualifies for medical assistance, right? Well, not necessarily. They still have to meet the Social Security disability criteria. Those criteria are different than the criteria for special education. Same thing with diagnoses. My child has just got a diagnosis of autism. So he qualifies for the medical assistance card, right? Not necessarily. Again, they have to meet the Social Security criteria, which I've put in your materials here, and they are fairly detailed. So the diagnosis alone is not sufficient. The diagnoses help tell you which criteria you look under, but it's not alone, it's not enough by itself. However, in the situation where the family applies for SSI and Social Security determines that the child does not meet the Social Security disability criteria, you cannot then go ahead and apply for medical assistance under the loophole, because to qualify under the loophole, the child has to meet the Social Security disability criteria. And once Social Security makes a determination that the child does not meet their criteria, that determination is binding on medical assistance. So if you get into the situation where Social Security says child does not meet disability, it is very important to appeal, and you do have an appeal right, because that determination is not only going to preclude the child from receiving SSI, it will in most situations preclude the child from also receiving medical assistance. However, if Social Security says the child does not meet the SSI income guidelines, you then go ahead and apply for medical assistance under the loophole, because remember, SSI counts the parent's income while loophole medical assistance does not. All right, are there any questions about eligibility? Yes, in the back. Speak up. Sorry.
It's not a question about eligibility. I would just like to have a little bit of differentiation between SSI, SSD, SSA. Could you kind of define them a little bit?
Yeah, okay. Let's go back to the slides, because I did try to do that. Let's go over that again then. Okay. All right. Here's a slide. First of all, when we talk about kids, we're not talking about SSD. SSD is Social Security Disability, and it's a common misnomer that children are on disability. Children with extremely rare situations are not receiving Social Security disability benefits. They may or may not have a disability, but that is not relevant to the receipt of regular Social Security. Children receive Social Security, and we're talking about regular, not the SSI, I'll get to in a second. They receive Social Security based on a Social Security account, it's up here, of a parent who is deceased, retired, or themselves disabled. Well, it doesn't matter whether the child has a disability. The child, I should say, the children of that parent share in 1/2 of the parent's Social Security amount. So if it's one child, the child gets 1/2 of what the parent would get. Two children each get 1/4 of the parent's amount. Okay? That's Social Security children's benefits. There's no medical assistance that comes automatically. You have to apply separately. But if the child does have a disability, that Social Security benefit is not counted for medical assistance under PH 95 loophole. The SSI, although it is through Social Security, is a completely different program. That program does require that the child meet the disability criteria, and it does look at parental income and assets until the child turns 18. That program, SSI, also provides automatic full medical assistance benefits without a separate application. Does that answer the question?
The PH 95, is that a loophole for SSI?
It's separate from SSI. It's for the kids who cannot qualify for SSI due to parental income. SSI counts parents' income, PH 95 does not. But under both, the child has to meet the Social Security disability criteria. We okay on that? No? Yes? Another question? Okay.
Who's in the loophole already?
Uh-huh. Yes?
And they age out at 18 while they're still in school.
We're going to get to that. That's the second PowerPoint. No, that's a very good question, and we are absolutely going to get to that. So let me move on here, because what I want to talk about is services, and then I'm going to talk about what happens when children become adults. And that's one of the things we're going to talk about. Okay, services. So you have this medical assistance. What's it pay for? Well, it pays for a wide variety of services, broader than most health insurance plans. It provides for hospitalization, physician services, tests, prescription drugs, is full prescription drug coverage for kids, physical therapy, occupational therapy, speech, durable medical equipment, medical supplies, nursing services in home, home health aides, personal care services, and a variety of behavioral health services broader than most insurance plans, not just inpatient psych, partial hospitalization, outpatient, but also wraparound services, family-based, RTF therapeutic services. Yes? The provider has to, well, okay, let's move on here. Let me get to that point. Yeah, where is it? What they have to accept for the physical health side is they, first of all, for the folks living in this area, for the physical health, you're going to have to, with an exception I'll get to in a minute called HIP, you're going to have to sign up for one of 3 HMOs, Gateway, United, or UPMC for you. So when you talk about accepting, for physical health services, the provider has to be enrolled in one of those 3 HMOs, be what they call a network provider, unless you get special approval from the HMO to go outside of network. Now, you can request approval to use what's called a non-participating provider. To do that, you need to have, most typically, a physician. And that would typically be the primary care physician. When you enroll in an HMO, you're given a primary care physician. And the primary care physician can make a referral to a specialist. And if it is a particularly rare condition, they can make a referral to a specialist that is outside the network on the grounds that the HMO does not have specialists in the network that can treat that particular condition. So that's a possibility, but typically you would have to use a provider who is in the network. That's for the physical health. Then there is a similar issue in terms of behavioral health. In behavioral health, you also have networks, but there you don't get to choose. In the physical health, you get to choose between Gateway, United, and UPMC for you. In behavioral health, it depends where you live, what county you live in. So for folks here, you're either in a county that's being served by community care or by Value Behavioral Health. And you would have to use providers that are enrolled with either community care or Value, but again, with the possibility of getting an out-of-network provider. So one of the things that we do is to represent families who are trying to get an out-of-network provider for their child. It's not easy. You have to have support from a psychologist or psychiatrist who's recommending a specific out-of-network provider, sometimes an out-of-state provider, but that can be done, and that's one of the things we do. Now let's go back. So we have enrollment in for the physical health, one of the 3 HMOs. Talked about using network providers. And by the way, this gets a little confusing, but in terms of using any of the psychotropic medications, the psychiatrist would be paid for under the behavioral health component or perhaps under your primary insurance. It's not paid for by the Gateway, UPMC, or United under their medical assistance. You may have a commercial HMO through, say, UPMC or Gateway, but it's not paid for under the medical assistance HMO. But once you get the prescription from the psychiatrist, then you use either your Gateway, your United, or your UPMC card to go to the pharmacy to get the prescription filled. All right, now there are some folks who, and some kids, who are, oh, I'm sorry, there's a question. Yes?
This has been the case, and I just wanted to make sure that it still is the case. Based on the health care and the medications, what I've been told and used is if Med-Assistance is a secondary insurer, let's say I have Highmark for my kids, if Highmark covers the provider and the provider participates in the state medical assistance program, even if not with, say, UPMC or you, they still consider that
Right, no, yes, correct. If the prescriber is not necessarily in one of the HMOs but accepts medical assistance, then that script can still be filled, yes. Uh, now for the hospital, no, I'm confused when you meant for the hospital. What?
My son had to get tested at a particular hospital.
Uh-huh,
The hospital participated in the timeline. I tried that.
okay.
But not with UPMC secondary. However, the hospital said because they do participate in the state medication program, he could be treated at that hospital because medicine follows primary. And they let him cover the admission even though they did not participate in UPMC for years. So it gets pretty complicated.
Yes, I must confess the issue about with the hospitals, I'll have to defer to them. If their thing is covered, I'll believe that. That part, however, is I wasn't aware of that part.
At least that was true for years at a time. Who knows that has changed. But medication, pharmacy has to call for an override, but it still appears to follow primary, where MA is secondary.
Okay. And the other thing you need to know about the medications is all insurance plans have a certain list of medications that they cover. That's called a formulary. So one of the issues you run into is if you have primary insurance and then you have medical assistance as secondary, typically you're looking at medical assistance to pick up the co-pays on the prescription. But they may have different formularies. So you could run into this situation where the drug that's being prescribed is covered under the primary insurance, but it is not covered by the particular HMO formulary that you're using for medical assistance secondary coverage. And in that case, the pharmacist has to ask for the override for the coverage if it's a non-formulary drug in order to get the copay covered. Okay, the HIP program, this is the one situation where the child, and this also applies to some adults, would not be in one of the 3 HMOs. And the HIP program is what stands for Health Insurance Premium Payment, and that's exactly what it is. It's a situation where a child could be covered or is being covered under a parent's own health insurance, typically through an employer, but where the parent would have to pay or have deducted from their pay an additional amount to have that child or children covered. Okay? There are situations where the state will actually pay that additional premium to have the child covered under the parent's health insurance. The state decides whether they're going to do that. If they decide to do that, then as far as the parent is concerned, it's effectively a pay raise because that money is no longer being taken out of your paycheck. And you keep the medical assistance for the child as well. The child doesn't lose the medical assistance, but they get switched from the HMO they were in back to the old-fashioned medical assistance, the yellow access card. That can present a problem because not all doctors or not all specialists, providers accept the old, what they call fee-for-service medical assistance. Some of them just accept the HMOs. So in the situation where a child is taken out of the HMO and goes to the old fee-for-service medical assistance, and that change would disrupt the child's continuity of care because an important provider does not accept the access card, they can be taken out of the HIP program, put back into the HMO so they can continue to receive the care they need. However, you should know that if they do that, the state will no longer pay that health insurance premium. That will then start coming out of the parent's paycheck. Okay? No question? Was there a question? No? Okay. All right, behavioral health services. I started talking about that. There's a number of services that are available for children and adolescents under 21. Probably the most common is BHRS, Behavioral Health Rehabilitation Services, commonly called wraparound. That includes the TSS, the mobile therapist, and the BSC, Behavioral Specialist Consultant. There are residential programs, two of them, the RTF and the CRR Host Home. A CRR Host Home is kind of like a foster care arrangement with behavioral services added. So the child lives in another family's home, but is assigned to a behavioral health provider that provides services to that child. There's also therapeutic summer camps. They're called STAP. Another service called family-based therapy, not commonly used for kids on the autism spectrum. And then there may be a number of localized programs, often for kids on the spectrum, which are approved by CCBHO or Value. There are also some new treatment modalities called evidence-based, hi-fi, wraparound, multisystemic, functional family therapy. These, however, are not really designed for kids on the spectrum, so I'm not going to cover those. There are some limited family support services and respite through the county-based service units. Each county has an MHMR, or maybe more than one county joined together, and they then can either do this directly or have county-based service units. Children can be enrolled into the mental health system and have a case manager known as a resource coordinator or an ICM, and you can work with that case manager to try to access any family support services, which includes respite. Each county has received a small pot of money to provide respite services to children in the mental health system, not specifically for kids on the autism spectrum, but does include them if they are enrolled in the mental health system. But it's just a small pot of money, and I have no idea whether there's any left right now. It's pretty late in the fiscal year, so I suspect that there probably is little left at this point. And there may be other local programs. The managed care organizations, Community Care and Value, have certain requirements about excess money. These entities had in the past had a little bit of money left over, which might be considered profit, except that they're not allowed to keep that money. They have to reinvest it in services. So there are reinvestment dollars which can go to special programs like after-school programs and some specialized programs for kids on the autism spectrum. So how do you access these services if they're paid for through Community Care or Value? It starts typically with a psych eval. It's an evaluation done by a licensed psychologist or psychiatrist. Then there is an interagency service plan team meeting, and a treatment plan is developed based on the evaluation, the psych eval. The psych eval has to actually recommend specific services. It doesn't just give a diagnosis. It has to set goals, and it has to set specific services. And those services typically would be TSS, mobile therapy, BSC, or STAP if you're looking for the summer camp, and it needs to specify a specific number of hours of each of these services, and it should also specify where the services are to be provided, home and community or in school, and if in school, how many hours in school. Then after the psych eval and the treatment plan and the interagency service planning team meeting is held, a number of documents are done at the planning team, a lot of paperwork for the parent to sign, and then that packet of documents is submitted either to Value or Community Care, depending on where you live, and they then have to make a decision whether they will approve the requested services or approve something less or offer a different service. And the parent will then get a written letter from Community Care or Value, which says that these services have been approved, or a lesser amount of services have been approved, or they're offering a different kind of service. If Community Care or Value does not approve the full amount of the exact kind of services that were requested in the evaluation and in the treatment plan, the family has a right to appeal that. That is considered a denial. Even if it's a lower amount, that is a denial, and the family has a right to appeal, and we're available to assist the family with that appeal. A new psych eval and interagency service plan team meeting is required every 6 months for wraparound, except for kids on the autism spectrum, for whom the evaluating psychologist or psychiatrist can request a 12-month authorization period. All right, moving on. Any questions about these services for kids? And I'm going to get to adults, hopefully, if we have enough time. Okay? All right, and we want to move on to the connection to education and early intervention. So early intervention, that, of course, is a separate program. And for the birth to 3 kids, it is the program usually run through the county MHMRs. And that program has a medical assistance component called the Early Intervention Waiver. That is, however, really a funding mechanism. It does not provide additional services. The services are determined by the child's support plan, the IFSP. In terms of special education, there is a special form of medical assistance that school districts use, and that parents may be asked to sign permission for the school district to bill their medical assistants for special ed services that are provided in school. This program is called the School-Based Access Program, and it is a special program. It does not give the child an entitlement to any additional services. The services that are provided by the school district, either by the school district or through the IU, are determined by the child's individual education plan, the IEP. However, this school-based access program enables the school to draw down additional federal dollars, so hopefully the school would be more willing to provide additional services because they're getting additional funds. So for most families, it's perfectly fine to agree to have the school district bill medical assistance for the services, because those medical assistance services that the school district bills does not affect the services you receive outside of school. Yes, question.
So can another provider, service provider that is going through medical assistance bill at the same time?
Yes. Yes, they can. There's been a lot of confusion about that, but they can bill they can bill at the same time, as long as they're not billing for an in-school service, of course. Without a school service, they can bill it at the same time as per. Yes, speech therapy. Child receives speech therapy through the school, through either, say, an IU speech therapist. The child either goes to an IU program, or the speech therapist comes to the school and they do speech therapy for the child 1 hour a week, and maybe it's a group speech therapy. Mom says, I think my child needs more speech therapy than 1 hour a week, and takes the child to an outpatient speech therapy clinic, uses Gateway United or UPMC to pay for that. Can they bill for that? Yes, they can bill for that too.
But again, you have to find a speech therapist or that will accept one of these providers.
Oh, yeah, sure. Well, that was, yes, we,
Like, we got
Right. Okay, okay, and here's what you do in that situation. The HMOs all have to have special needs units. Okay? You call up member services, you ask for the special needs unit. They're required to have that. You tell the special needs unit person, can't find a speech therapist that accepts whatever your plan is. If they can't find you one, then they are responsible for paying for an out-of-network speech therapist if they cannot find you one. And that's something the Health Law Project can help you with. Right. And it is more typical for the therapies than it is for other services. You go to the special needs unit, you make your case. They are required to help you find one. If there isn't one, you do have the right to ask that they pay for an out-of-network provider. Yes?
What if you have a child that's accompanied by a TSS throughout the school day, and the presence of that TSS is necessary to maximize the child's interaction with the speech therapist? Are you able to bill NA for both of those simultaneously?
Yes, they're two different services. They're two different services. Yep, you can. Now, I can tell you that there may be an issue. It's not that it can't be billed, but where the problem comes up is the issue of medical necessity. You may run into this situation where community care or value says you don't really need the TSS. The speech therapist ought to be doing all that. And then you need to appeal, and we can assist you with that. Yes, in the back.
Would the IEP be an example of where more than one party could bill at the same time?
With,
Because the IEP being funded through that through the school's own service, school-related, or?
well, certain services in the IEP are what the school district can bill for under the school-based access program. Not everything, but certain services. Yes, so that is an example. So if speech therapy is on the IEP, the school district, if it participates in school-based access, can bill for that, but the parent can still get the speech therapy outside of school, and as long as they can find a provider that accepts their HMO, and that can still be billed for. Okay, one catch on this school-based access program, it's at the bottom here, and that is the situation, while it would not affect or limit coverage of regular medical assistance, the one situation that has come up in a court case recently is where the family had a malpractice case. Let me give you, I'm not sure the facts of the specific case, but I'll give you an example. Child born, this not the kind of thing you'd see so much on the autism spectrum, but a child born on, say, with cerebral palsy, and that's can be a result of problems during delivery, childbirth, and so malpractice case is filed against the obstetrician, and then there is a money damage award. In that kind of situation, if the parent had signed to allow the school to bill medical assistance, what medical assistance will do is take money out of the damage award for all those special ed services that had been provided and billed to medical assistance. Okay, so that's one situation where you don't want to give the school district permission to bill medical assistance. Okay, private insurance. Let me talk about one particular part of private insurance that's quite relevant today, and that is Act 62. Act 62 is the autism insurance law, and this requires certain health insurance policies to cover a wide range of both diagnostic and therapeutic services for children and adolescents under the age of 21 who are on the autism spectrum. Now, it applies, it doesn't, let me tell you who it does not apply to. It does not apply to policies that cover less than 51 employees. So this is only for group health insurance plans of 51 employees or more. Does not apply to self-insured policies. Chances are you won't be able to tell from your health insurance card whether it's self-insured or not, but if you work for a larger company or for a government entity, there is a real likelihood that it's self-insured. You should contact your HR unit to find out if, in fact, that policy is self-insured, because if so, Act 62 does not apply. Now, a self-insured plan may choose to cover autism services, and that is something that you can raise with your employer. There's no restriction, and because under a self-insured plan, it's the employer who decides the scope of coverage, not the insurance company, because the employer ultimately is paying all of the bills. So you can advocate with your employer, and I've worked with families who have done that, to try and include autism coverage under a self-insured plan, even though it's not legally mandated. And finally, Act 62 does not apply to out-of-state insurance policies. But it does require, for those plans it does apply to, it does require that the plan cover ABA, Applied Behavioral Analysis, which is a service, I hope most of you know what that is, and it's a service that is provided by many of the medical assistance wraparound providers. There is a cap on the amount of coverage. It's $36,000 annually. Now, this does have an impact, however, on the medical assistance because, as was stated earlier, the medical assistance is always secondary to the commercial health insurance. In order, if you have a plan that covers the ABA services under Act 62 or a self-insured plan that has voluntarily chosen to cover ABA services, you've got to find a provider that will accept that insurance plan. You cannot just use the medical assistance or community care or value alone. You've got to use a provider that accepts that insurance. And then that insurance may have co-pays. So if the provider also accepts community care or value, then those co-pays would be paid by community care or value. The problem arises where the child, and I've had one client in this situation, where the child was receiving services through a provider under medical assistance, under, let's just say community care, and then the Act 62 went into effect on his policy, so now he had other coverage. That provider did not accept that coverage. They could not continue to be treated by that provider under community care because you have to use the primary insurance first. And that goes for any of the services, prescription drugs, whatever. Okay? So, now I want to go on to what happens when you become an adult. And hold on a second. And, okay. Let's see where he put that. Oh, sorry. It goes here. Where is it? Okay. I'm having trouble finding the other file. Finding where you put the other file. Oh, you put it on the desktop? This. Okay, got it. All right, thank you. Okay, so let's move on. Thank you very much. So what happens when the child turns 18. Two things happen. One, if they're receiving SSI, they would still continue with that SSI, but their disability would then be redetermined using the adult criteria. And the other thing that happens is that the income and the assets of the custodial parent are no longer counted for SSI. Let's go to this. Now, that actually has big implications for kids on the loophole. The implication is that the loophole, PH95 eligibility, stops at age 18. Okay, let me repeat that. Medical assistance under PH95 loophole stops at age 18. So what happens? At that point, you need to apply for SSI, because the child who had not qualified for SSI due to parental income or assets, that income and assets no longer counts at age 18. So you apply for the SSI. Now, the SSI, let's go through some of the eligibility. SSI eligibility for adults, both 18 years old and older. There's some very complicated issues for immigrants. Don't have time to go through them. I did, however, put a link to a website where you can find a lot more information about SSI eligibility for non-citizens. Okay, for citizens, what you're looking at, one is income, but only income of the adult, not income of the parents. The income limit varies depending on whether the individual is living with parents or others, and if so, paying a pro rata share of those household expenses. It also depends on how much of the individual's income is earned income versus unearned income. So unearned income would be if they're receiving some Social Security. We talked about Social Security child's benefits. Okay? The Social Security is counted against SSI. If you're getting Social Security, why would you want SSI too? In order to get the medical assistance. Now, youths under 22 can get SSI and work. There are special income disregards for youths. And so I guess what I'm trying to say here is that although we're concerned about ensuring that the youth continues to receive medical assistance, we also want to encourage folks, young adults, to work. And there are certain provisions that allow individuals to work and still receive their benefits. And this is one of those. For youths under the age of 22 and regularly attending school, they can earn up to $1,700 a month without it affecting their SSI, with a gross maximum, annual maximum of $6,840. And regularly attending school only means 12 hours a week of school or 8 hours in college, or less time for reasons such as illness. So this is a particularly important provision to encourage young adults to work part-time or take a summer job, and it would not affect their SSI or their medical assistance through SSI. Now, assets are also counted for SSI. The limit is $2,000, so here again you want to watch out about how much money is put into any kind of an account or any bonds or certificates of deposit or other kinds of investments in that adult's name. You don't want to do it as a child either, because when they reach 18 and looking to keep the medical assistance under SSI, that money is going to come back to haunt them. So the limit is $2,000 for a single individual. The special needs trust, if properly drafted, are exempt. That money is not counted. Any grants, scholarships, or fellowships set aside to pay educational expenses are not counted for 9 months after receipt. So it's okay for the grandparents to give the young adult some money to be used for college, so long as it is spent for college in 9 months. A house that is the adult's primary residence, so that you can actually give your adult child a home and put it in their name. Now, whether that's a wise idea is another question, but you can do that, and it would not affect their eligibility for either medical assistance or SSI or any of the waivers, so long as there's a primary residence. One vehicle, household goods, life insurance to $1,500 in face value. Disability criteria are different than they are for kids. There is a very useful website. That's not the right one. Here we go. Yes?
So assets held under 529 plan would be exempt then?
Assets held under what would be exempt?
529 plan.
No idea, sorry.
That is that's a plan used for college investing that is arranged through various states. Many states have programs that they work with private mutual fund companies and the like. It's a vehicle for parents to fund college.
Gotcha. Okay. And I don't know that one. That's something you would need to look up. On Social Security website, there is actually a particular set of very detailed rules called the POMS, and you would look in there, POMS, under SSI, and then within SSI under assets, and they have very, very detailed rules. So I'm afraid I can't answer that one, but that one you should research. The POMS will give you the answer to that. Okay, the disability criteria, I recommend looking at the, this is the, disability planner, and the general rule about disability for adults is you look at first, are you working? And that is considered earnings averaging more than $1,000 a month. Then, is your condition severe? Is it a condition found in the list of disabling conditions? Did you work previously? And can you do any of the other kind of work? That's the basic criteria that they go through. This is the listing for autistic disorders and PDD. I'm not going to read that. It's in your materials. There is a great website here that gets you to this adult disability report, which is an excellent way of finding out more about disability. And this is both for SSI and for Social Security disability benefits. Now, we talked about the child's benefits. At age 18, the child will lose those Social Security benefits unless, A, they are a full-time student in a secondary school, in which case they can stay until 2 months after reaching age 19, or B, they are found disabled under the adult criteria that we talked about here. Okay? So, in that case, they would then start receiving Social Security disability benefits. However, those benefits do not provide medical assistance. And once they turn 18, that Social Security benefit, which was not counted under PH 95, will now be counted. Okay. Now, if the Social Security says that the 18-year-old does not meet the Social Security disability criteria, it's important to appeal that decision, because although there are some other medical assistance eligibility categories, most of those that would be applicable to a young adult on the autism spectrum require that that individual meet the Social Security disability criteria. Now, however, if the individual does not qualify for SSI because, for example, they have too much income, most notably Social Security benefits on a parent's account, they may qualify under a different category called Healthy Horizons. That has an income limit of $931. So if they have Social Security, say, of $900 a month, that puts them over the SSI limit, but they could qualify under Healthy Horizons. There's no asset limits for Healthy Horizons until they reach the age of 21. If they are over the income limit, the $931 income limit, or over the asset limits, they can also apply under a different category, and there are two. One are the waivers, and the other is MAUD. Waivers have a higher income limit, $2,000 a month, asset limit of $8,000. We're going to get to them in a minute. And the MAUD program is very important because this is a program that encourages people with disabilities to work, and they can actually make a living wage and still qualify for medical assistance. They will have to pay a premium, but it's well worth it. I'm going to skip ahead and get to the waivers. Just to mention, at age 21, some of the important services that were paid for under medical assistance are no longer covered, most typically for individuals on the autism spectrum, wraparound services. The TSS, mobile therapist, BSC stop at the age of 21. And when I say 21, I don't mean the end of the school term. I mean on their birth date. So let's see about what other waivers are available. Waivers that exist include, there are two waivers for persons with intellectual disabilities, and many of adults on the autism spectrum are also are in this waiver, these waivers, but they must have an intellectual disability. It's not the autism that gets them qualified for this. And those waivers are the PFDS and the consolidated waiver. What's important to know is, unfortunately, there are long waiting lists for this waiver. Let me tell you, these waivers, the way you apply is through the base service unit of your county MHMR. They will do an assessment called a PUNS, which determines the urgency of need for services. And based on that PUNS, they will put you on one of three categories. Only the folks in the top category, emergency services, have any shot of getting a waiver slot. And there's long waiting lists for this. There's a lot of families who are working with their state legislators to try and get more money into these waivers to expand the number of slots so that more people can be served under them. I'm going to skip ahead because we are running out of time. There is also some small pots of money called family support services or family-driven support services that are available through the county MHMRs, but they are usually very limited amounts. The autism waiver, which was mentioned here previously, there is no open slots for this either right now. However, you are urged to phone in. This is only for persons 21 and older. And the phone number is here, that 866-539-7689. Callers will go on an interest list so that if any slots open up, then they will be reviewed depending on whether they are receiving state-funded services. If they're not, they go to what's called Priority 1, and they will be the first ones served. And I left a website there where you can get more information about the autism waiver. OBRA waiver is another waiver where there's approximately 140 some individuals on the autism spectrum who are receiving intensive community-based services under this waiver. It was started by Autism Living and Working, but that waiver is now closed, unfortunately, so I'm not going to spend any more time on that. It's in the materials. I have a number of slides here that go over the different services and how you apply. I do want to mention one of these waivers that's in this slide here. At the top, you'll see independence. This is a waiver for people with physical disabilities. The reason why I mention it, however, is it's only one of two waivers that actually have any open slots. This one and one called attendant care. The independence waiver could be useful for persons on the autism spectrum if they also have significant physical disabilities as well, because it does provide a variety of services, including a service called community integration, which assists with community activities. It can provide some behavioral management services and counseling, and can provide nutritional counseling. So this is a waiver that might be potential, but the individual must have a significant physical disability in order to qualify for this one. You apply by calling the 877-550-4227 phone number. That reaches a contractor called Maximus, which will do an evaluation. They will be focusing on the physical limitations. And the rest of this is the various waiver services. Last thing I want to mention, again, don't take no for an answer. There are appeals. The one area where you can't appeal is in terms of the waiting list for the waivers. Unfortunately, that's not an appealable issue. You've got to work with your state legislators to try and get more money into the system to expand the number of slots. But other issues, like we talked about wraparound before, if that's being titrated, you can appeal that. If you are lucky enough to have a waiver slot and the services you're asking for are not approved, you can appeal that. And if you're currently receiving a service, either under waiver or under medical assistance, and whoever has authorizing that service has said they are going to reduce the amount of service or terminate that service that you had been receiving, if you appeal within 10 days, they must continue to cover that service and pay for that service at the existing rate while your appeal is pending. Please give us a call at that 800 number for more advice and assistance. Yes? Well, you're talking about SSI or the waiver? SSI, I recommend to do that around 3 months before. Right. Because it takes a while to do, because they'll have to do a disability determination. Wait, hold on. Given the medical assistance eligibility, they're automatically eligible for the waiver. No, they have to, in addition to being financially eligible for medical assistance and meeting the Social Security disability criteria, they also have to meet functional levels of care. And, pardon me? No, for the waiver they have to. They don't have to meet functional levels of care for medical assistance. They're different. They have to meet an institutional level of care for waiver. So for the intellectual disability waivers, they have to meet a level of care for an ICFMR. For autism, it's ICFMR or a facility called an ICF-ORC, other related conditions. For the OBRA waiver, it's ICF-ORC, and for independence, it's a nursing facility clinical eligibility that they have to meet. And there are specific assessments done for those levels of care. No, they don't designate a specific IQ test. No, they don't. Okay, yes?
Act 62 was presented to Pennsylvanians as a law that was going to improve access for children and families living with ASD. And I'd like to hear your comments and appraisal as to what you think of that law and whether it's had that impact.
So far, it has not had that impact. I think that we have now the opportunity to have that impact. The reason why it had not had that impact is what was being paid for primarily up to now was services that medical assistance was already paying for. So it saved the state some money, although not nearly as much as we had hoped, but it didn't expand a lot of services. What's changed just recently, this month, was that the regulations to license behavior specialists under, and this is not to be confused with BSCs or BCBAs. This is a new category. Behavior specialists, as defined by Act 62, will now have licensure that has been, the regulations to license these folks have now been approved by a special entity called the Independent Regulatory Review Commission. So those regulations which came out of the State Board of Medicine will now be implemented so that therapists can now be licensed as behavior specialists, and once they're licensed, then the insurance companies will have to pay for that service under Act 62 outside of medical assistance. This was not so there are a number of therapists providing services who did not participate in medical assistance. They were private pay only. Those therapists will now be able to get covered under private insurance under Act 62. So I am hopeful that now that we have the licensure in place, that this will expand services. But without the licensure, the insurance companies were not paying these therapists. Now they will have to. Yes, in the back. The State Board of Medicine's website, which is under the Department of State. You can also look for the Independent Regulatory Review Commission. And if you Google the Independent Regulatory Review Commission, you can also find those, because those regulations are also published there. Yes, yes.
To qualify for the MODS program, do you need to go through a full Social Security disability evaluation?
No. No, you do not. Most people are already receiving Social Security disability benefits, so they've already had it, but if you are not, you don't. And the reason is because the disability criteria for MAUD are a little different. If you are working at a certain level, you are not eligible for Social Security disability. This is an exception. You have to have a significant disability, but it also covers people who have been able to hold down a full-time job. And I have two clients who have full-time jobs making a living wage and still keep their medical assistance and their waiver services. Because of MAUD. Okay? Other? Yes? Oh, sorry. Okay.
I was going to ask you, how many times can you appeal a decision on Social Security disability insurance?
How many times can you appeal? Whether there's, okay, you have the reconsideration, and then you can go to the administrative law judge for the hearing, and then from there you can go to the appeals council, and from there you can go to federal court. So 4. Yes?
For the MAUD, if you don't have to go have Social Security, how do you go about, who determines how much of a disability you have?
Good question.
In order to...
All right. You have to present the documentation. Who determines it is there is a company under contract with the Department of Public Welfare that does that. They're called the Medical Review Team, and that documentation is sent to that company, and they make that decision.
Would most people with autism qualify?
There's no way to answer that, because most people, there's such a wide spectrum as to the degree of involvement. So there's no most people with autism. It depends on the degree of the involvement, quite honestly. So, but it's definitely worth trying. Definitely try for it. Yes?
If an individual who is on SSI, who is medically
Yes, that's correct. And there is a special provision, and I actually had a slide in your materials that I skipped over. There is a special category of medical assistance for that situation, because the child would lose their SSI, go into Social Security disability, but as I said before, the SSI is what got them the medical assistance in the first place. If they're losing the SSI because they then became eligible for Social Security disability on a parent's account, it's a special category that enables them to keep the medical assistance indefinitely, called a disabled adult child category. I say indefinitely as long as they don't have other income that would disqualify them. So that Social Security is disregarded in determining their ongoing eligibility for medical assistance. Yes? SSDI. Yes. 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 Okay. That it? Oh.
Any update on co-payments for medical assistance?
Yeah.
Timing of them?
The co-payments, and there is a slide, I hope it's in your materials, on the co-pays. And this affects the kids on PH 95 under the age of 18, where the parent's income is at or above twice the federal poverty level, which for a family of four is $46,000. We had heard that they were going to start it in September. Now we're hearing they may not have the logistics, the operational aspects figured out, so it may be pushed back even later. And there's a slide in your materials on that. I think we're out of time. You can see me afterwards, okay? Thank you so much.
Thanks.